Today we are doing the unboxing of the drug acetaminophen. Acetaminophen? Acetaminophen? Acetaminophen. This drug has a wicked history, including tree bark and gut worms. Let's take a quick detour and check it out. Okay, imagine yourself as a pre-1900 Central American active resident, right? And you come down with the sweats and the body aches. And just like any good mother and grandmother said, go get the cinchona. Go eat some bark of some cinchona. Now, cinchona is a plant whose bark was found to alleviate the pains and aches and fevers of the time, right? But cinchona is a very small plant, right? It was very difficult to harvest in a mass quantity. So early drug laboratories started looking at things that had the same properties but could be mass produced through synthesization. Then fast forward to the year 1885, when there was a patient who had a known gastrointestinal parasite infection, and he was given a drug. Oops, he was given the wrong drug. He was given by accident acetanilide, okay? Patient's parasite, man, it kept living its glorious days, but the patient's pain and fever were eliminated. Ka-ching! Then a year before they realized that how toxic this drug was. Yeah, it treated fever and pain, but it gave you a bunch of nasty side effects. Enter in phenacetin, okay? Same fever fighting and pain fighting properties with very less toxic effects. Still many toxic effects, but not a whole ton. Fast forward to the year 1893 when they started looking at people's urine. I don't know why, but they started looking at people's urine and they found this interesting chemical called acetaminophen. You heard of it? They then just followed upstream and found out that these patients who had acetaminophen in their urine were taking acetanilide and phenacetin. So they started studying acetaminophen, and they found it was a good painkiller, and it was a good fever reducer, and it didn't have the toxic effects of the previous medications. Double win. So studies began. Now, holy moly, if you think drugs coming out to the market is an easy thing, you are definitely wrong. 1951, the FDA approved a patent for Tylenol, aka acetaminophen. Acetaminophen, baby. TikTok transition. Now, acetaminophen comes in a lot of different forms. This box is acetaminophen because it is a generic form of Tylenol, which lost their FDA patent in the 80s. You have caplets, easy tabs. Here is a gel caps, each one of them 500 milligrams. We'll also look at the pediatric doses, which is in liquid form, in my favorite, a grape flavor. Now, this medication comes in a variety of forms and doses, and each one of them has their own indication and contraindication to taking them. If you have any questions regarding this drugs, you need to have these conversations with your pharmacist or your primary care provider. The role of this YouTube channel is not to go in depth in each of these issues. So this is about education and entertainment. So first off, let's take a look at probably the most common version, the caplets or the tablets. These are 500 milligrams. You can see on the instructions on the back, it tells you how to use it. The same instructions are on the bottles. Then on the top, you've got the push down and twist. And as you can tell, I'm having a little difficulty with this myself. There's usually a seal on the top. This shows that after manufacturing, it has not been tampered with. There has not been any reduction in efficacy of the drugs because of oxygen exposure or moisture, or heaven forbid, some other alternate cause. So you'll see that these are long, white, elongated pills. These are very simple. They are hardened, powdery substance of a form of acetaminophen. This form doesn't have any enteric coating. Now, Tylenol is known as an analgesic and an antipyretic. Analgesic comes from the Greek words Algesia, meaning sensitive to pain. Its prefix is an or an, meaning without. So an analgesic is something that causes the absence or to be experienced without pain. Woohoo! I'm pain-free, baby! Woohoo! Wah-ha! Antipyretic means against or stopping of the pyretic or increased temperature, which is the pyro. Rub-a-dub-tro, 3 pills in a row. So let's take our trusty 11 blade. This is my favorite tool for incision and drainage of abscess, laceration, repair, removing of dead tissue. It's a fantastic tool. So right now we're just scratching the surface and trying to just get a feel for the components and strength and durability of this pill. We cut it in half. Geriatric populations will use a much safer pill cutter, which allows them basically a repurposed and miniaturized guillotine, what allows them to appropriately make alterations to the pills. Say if the prescription is only at 250 milligrams, I can cut it in half. Now, as much as you can imagine two scientists duking it out, they still don't really know what the mechanism of action is. They think it blocks the nitric oxide pathway, which results basically in an increase in pain threshold. As far as the antipyretic, they think it just regulates the heat center in the anterior hypothalamus. And one of the things I wanted to try to mimic was the body's breakdown of this medicine. The pH of a Sierra Mist found in my local hospital cafeteria is about 2.5. The pH of the stomach is about 1.5 to 3. So although this is a very rough recreation of the gastric pocket that is our stomach, we will pour some of the Sierra Mist into this clear container, and we will then take a full 500 milligram acetaminophen capsule, and we will then time the duration of which it goes down the esophagus into the stomach and begins its breakdown period. This breakdown is because of the protons or the hydrogen ions that are excreted by the parietal cells that line the stomach wall. Another thing that aids in the digestion of food and medicine is what's called peristalsis. This is when the muscles of the stomach and the esophagus flex in a coordinated fashion to help stimulate the acid, to mimic and pressure and to circulate that medicine and food. I'm just using the scalpel to try to mimic this. Now, I doubt that Mark Rober would at all be impressed with my trying to recreate the gastric context in this experiment. But according to the timer, it took about 2 minutes and 19 seconds for that medicine to be broken down. Now, that is only the beginning of a long journey for that medicine. Then it needs to be pushed down into the duodenal, where it can then start to be absorbed. Now, the peak plasma time of this medicine, the regular conventional tablet of 500 milligrams in adults, is about 6 hours. So if you take this medicine and you are anticipating immediate relief, it's not going to happen, okay? Now, again, there are some serious side effects to this medication. There are some great uses of it as well, okay? This is not an attempt to address any of those, okay? I'm here just to test out a new format on YouTube, try to create entertaining a way and different approach of addressing some of the medications I use and tell my patients to take all the time. So that was the first over-the-counter medicine unboxing and review. That was a super lame name. I gotta come up with something better. Comment below on any suggestions. Hope you enjoyed it. If at all you were educated or entertained and I earned a click, go ahead and subscribe. Love ya. Knuckles, noggin, butter like this, and squid fingers.